Good afternoon and welcome back to the San Luis Obispo local news channel. My name is Alex Kapos and today I'm joined by representatives from the HPV Prevention Network, Olivia Wilson and Emily Ramirez. They are joining me today to discuss HPV vaccination, which has become a topic of controversy in recent years. To start, I'd like to hear your input on a recent bill that has been introduced that would require informed consent from a parent or guardian for minors to receive any kind of vaccination. What are the impacts of this?
So first off, thank you so much for having us on today, Alex. It sounds like you're referring to Senate Bill number 2988, the Parental Consent for Vaccination Act. This bill was recently introduced and it would mandate written informed consent of a legal guardian for any vaccine to be given to an individual under the age of 18. This bill has not been passed, but it is one of many attempts by American legislatures to strip teens of autonomy in making their own healthcare decisions. If this bill or one similar to it is passed, it would likely decrease the country's already low HPV vaccination rate.
So, do any parts of our country currently allow teens to consent to their own HPV vaccination?
As of 2021, teens can get the HPV vaccination without parental consent in several states and regions, including Alabama, Alaska, California, Delaware, Idaho, New York, Oregon, South Carolina, and Washington, D.C.
So, what are the benefits of allowing minors to consent to this vaccine?
There are so many benefits of allowing minors to consent to the HPV vaccine. HPV is the primary cause of cervical cancer and causes other types of cancers as well. So most importantly, this vaccine is cancer prevention. In addition, HPV national vaccination rates are not as high as they should be. Healthy People 2020 planned on 80% vaccination coverage, and in 2019 we were only up to 54%. Studies have shown that in states where teens were able to consent, vaccination rates were up to 7% higher. In addition to the benefits for the sake of the country, this vaccine is necessary for personal health. Some minors may be interested in getting vaccinated, but they have parents or guardians that oppose it. This is an incredibly effective vaccine that could prevent cancer in the future. And not only that, it's most effective when given during adolescence. Minors should have the ability to protect their future health without barriers.
I completely agree that protecting the future health of our community's children is important. However, do you think that teens are mature enough to make major healthcare decisions surrounding vaccination?
While teens are still undergoing brain development, there has been evidence to show that many teenagers do have the ability to make decisions surrounding specific health topics like HPV vaccination. An article from the National Institute of Health states that as patients get older, their clinician may determine that the patient has developed the capacity independently to navigate an informed consent process for services like HPV vaccination, which offers significant benefits to the patient and few risks. In accordance with these findings, allowing doctors to encourage teens to take charge of their medical decisions as they mature could prove to be beneficial in increasing their confidence and self-efficacy skills.
So, why are some parents and legislators concerned about their children receiving vaccination without their approval?
So some parents may feel that these policies would take away their right to make medical decisions for their child. In addition, any changes surrounding vaccination policies can definitely draw the attention of anti-vax parents and groups. Legislatures may not want to face the controversy that comes from these policies surrounding vaccinations. It's important to remember, though, that the purpose of allowing minors to prevent HPV vaccination is to protect their own future health. This is a safe vaccine, and there's no hidden agenda behind that of getting the population healthy.
So, it's my understanding that HPV is a sexually transmitted infection. Do you think that's what our parents are really worried about? Would allowing teens to consent to vaccination for an STI cause an increase in promiscuous behavior?
Allowing teens to receive their HPV vaccines has not been linked with an increase in risky sexual behaviors. A study from the Harvard School of Public Health compared data surrounding sexual behaviors in two groups of teenagers, one in states where with HPV vaccine consent legislation, and the other group in states without that legislation. This data found that states with legislation showed no notable changes in regards to teens' level of sexual activity when compared to the data from prior to that legislation being enacted. So essentially, no, increased sexual behavior is not a concern. What parents should really be concerned about is ensuring the future health of their children and taking this important step towards cancer prevention.
So, what do you want our listeners to take away from this conversation? Should teens be allowed to consent to their own vaccine?
So the bottom line is yes. Despite the possible barriers, this vaccine is incredibly important in the prevention of cancer. Teens are mature enough to consent to a choice that will keep them healthy, and there are many positive impacts to allowing minors to consent. They'll be able to improve nationwide vaccination rates while practicing their own healthcare autonomy that will benefit them in the future.
Well, thank you both so much for joining me today. To learn more about this issue, please visit the HPV Prevention Network's website for information and resources.
Thank you so much for having us, Alex.
Of course. Well, this has been another episode of the San Luis Obispo Local News Network. We'll see you next time.